Hi everyone, it's Dr. Rebecca Adams here with another amazing film. Today we have case 19H001 from the RCPA website, e-cases, and this is the case of a 77-year-old man with a hemoglobin of 59, a white cell count of 3, and a platelet count of 61. And just let me share my screen. Okay, so hemoglobin of 59, white cell count of 3, platelet count of 61, and let's see what the MCV is, because that will really help us direct where we're going. So we have a small lymphocyte here, and we can see that we have red cells that are larger than the size of the lymphocyte, quite large red cells scattered around the place, as well as some little fragmented looking pieces of red cell, some fragmentation here, and some teardrop red cells as well. So we have a macrocytic anemia with teardrop red cells and some red cell fragmentation. And we have another really big clue right over here. So we have this hypersegmented neutrophil. So 1, 2, 3, 4, 5, 6, 7, 8 lobes. So we sort of already know where we're heading with this. I think we have a macrocytic anemia with basically a pancytopenia. We have the red cell changes, we have hypersegmentation of this neutrophil. So let's keep having a look around. So when we're looking at a macrocytic anemia, we have the sort of basic differential of megaloblastic anemia, and so that can be related to B12 folate deficiency, medications such as Hydrea or methotrexate, and with the hypersegmentation, we're sort of thinking more towards a megaloblastic anemia. If we didn't have hypersegmented neutrophils, or if we had some neutrophil dysplasia, that might point us more towards an MDS type picture. Other causes that we always need to consider are whether this could be alcohol. Now, the oval macrocytes tend to go more with a megaloblastic picture. Alcohol tends to have round macrocytes. So if we have a look around, we've got some more teardrops, we've got these oval macrocytes. We haven't really seen very many platelets yet. You can see we've got some of these really hypochromic red cells, and that sort of makes you wonder whether this might be a mixed deficiency. Most of them are well hemoglobinized. The other thing to consider is whether these are just little fragmented bits of red cell and they look a bit hypochromic because of the fragmentation, and you can sometimes see that in a severe megaloblastic anemia. And this is obviously a severe megaloblastic anemia because the hemoglobin is 59 and it's basically a pancytopenia. So we have some round macrocytes, but the majority are these oval macrocytes. We haven't really talked about the platelets. So platelets reduced in number, they look pretty normal really. There's no big hypogranular platelets, nice big macrocytes, but overall the platelets look pretty good. In terms of a differential for this film, I would say that megaloblastic anemia is by far and away the most likely differential, with medication as a possible differential, and then maybe MDS as a less likely differential. So for macrocytic anemia, there is an A, B, C, D, E, F, G, H mnemonic that you can use for the different causes. So A is for AML/MDS, B is for B12 deficiency, C is for COPD and copper deficiency, D is for drugs, E is for ETOH or alcohol, F is for folate deficiency, G is for genetic causes like Diamond-Blackfan anemia, and H is for hemolysis, hepatic failure, and hypothyroidism. So thanks for watching another amazing film, and I hope you enjoyed this. Bye.